Convention Planning Committee, and the entire AKISAN family for this opportunity and for choosing the theme which is apt and relevant with current public health climate both locally and globally. I am particularly thankful for this invitation because it allows me to do one of the things I love to do most. I love sharing and learning. I love the AKISAN gathering to the extent that I have attended this convention without fail since 2007. That is 11 years continuous attendance. So I really love to be here, and I love to give this keynote address. My biggest dream, hope, and aspiration is that AKISAN will carry on doing great work with its objective of promoting the interests of the citizens of Akwa Ibom State of Nigeria, both in the homeland and the diaspora. Throughout time, diseases and health issues change. Globally, the World Health Organization has identified a number of public health challenges that need to be addressed in this era. The Sustainable Development Goals, which came into effect in January 2016, has broader and ambitious goals. This new agenda integrates all three dimensions of sustainable development: economic, social, and environmental. And they are relevant to all people in all countries. One of the 17 goals in the SDGs has been specifically devoted to health. Goal 3 is to ensure healthy lives and promote well-being for all at all ages. I want to state categorically that all cultures have systems of health beliefs to explain what causes illness, how it can be cured or treated, and who should be involved in the process. The extent to which people perceive health education as having cultural relevance for them can have a profound effect on their reception to information provided and their willingness to use it. Western industrialized countries like the United States of America see disease as a result of a natural scientific phenomena. So they advocate medical treatments that combat microorganisms or use sophisticated technology to diagnose and treat disease. Other societies believe that illness is the result of supernatural phenomena, and they promote prayer or other spiritual interventions that counter the presumed disfavor of powerful forces. It is not uncommon to think of something crude and bad whenever we talk about cultural practices and traditional beliefs as they concern health. Ladies and gentlemen, may I just crave your indulgence to give me the opportunity to deliver this keynote address, please. It's a bit noisy. The teacher in me might just come out and I can tell a few students off. Please, may I crave your indulgence to be quiet so that we can all hear me. So I said that it's not uncommon for us to think of something crude and bad whenever we talk about cultural practices and traditional beliefs. Not all cultural or traditional practices are bad. However, some have stood the test of time and have positive values. Others are uncertain and negatively harmful. The cultural practices of a people not only affect their health, but they also affect all aspects of life, including social relationships, contribution to societal functioning, and disease condition. Each society or community has its peculiar way of doing things, and these practices go a long way in influencing people's perceptions, attitudes, and behaviors in the management of their health conditions. For example, ill health and other misfortunes, which oftentimes defile scientific and orthodox treatments, are explained as spiritual forces directed by witches, wizards, sorcerers, evil spirits, or angered ancestors. The popular notion is that people do not just suffer illness by chance, that serious illness is believed to have its origin in a primary supernatural cause. So I'm just going to give you a small case study about my experience of how people often in our part of the world define health conditions as related to witchcrafts and wizard. So let's look at a condition like dementia and its associated stigma, which I have spent the last few years campaigning against. I have held seminars and workshops in at least 13 local government areas in Akwa Ibom State. I have run a few seminars at AKISAN conventions as well. These workshops have been attended by over 4,000 Akwa Ibomites thus far. I have recently led a dementia walk and presented a large-scale awareness talk at the Market Square in Uyo. And I also launched the Dementia Schools project in Akwa Ibom State. There is a general lack of understanding regarding dementia in our community. Diagnosis is very poor, and stigma in relation to people living with dementia is rife. Carers of people who live with dementia feel shame and embarrassment about the person they care for, as well as concern regarding the impact of this stigma on their families. They experience fears, family separation, superstition, negative spiritual framing of behaviors, accusations of wizardry and witchcraft. A lack of awareness and social stigma presents significant challenges to the development of dementia-friendly initiatives in our country and in our state. Ladies and gentlemen, I have heard it all. I have been in workshops where parents turn up having just been evicted the day before, simply because of the lack of understanding of why they are speaking about the past. And this, for me, is a negative traditional belief, most of which are linked to some of our churches, linked to some of our superstition, linked to our lack of understanding of the issues. But I'm so proud to say to you that Akwa Ibomites have the appetite to learn. Of all the local government areas, all the workshops that I've done, when people hear about dementia, the impact on the brain, the symptoms, I have an overwhelming regret from people wishing they never did it, but we always insist that they don't feel guilty, that this is time for us to work together and improve things. As you may have noticed, by now, many of the challenges are related to human behavior, beliefs, and attitudes. The question before us is, how do we handle these challenges? How do we support individuals that constitute our family and society to choose and live a healthier life and to protect health? There will always be challenges. That's what makes life interesting. Overcoming these challenges is what makes life meaningful. Within challenges, therein lies the opportunity. Do not bow to these challenges, for they will become obstacles. The global agenda on sustainable development will work if it is given the local context. And our local context means that we need to understand our traditional beliefs and work from there. Our government and Ministry of Health in particular needs to continue to work in tandem with other ministries like Ministry of Education, other stakeholders like churches, traditional rulers have to be involved. We need to use all strategic tools of educating, marketing, policies, laws to ensure healthy lives and promote well-being in our Akwa Ibom state. Investing in public health will and does work. Although there will always be skepticism, criticism, but I believe through partnership and collective actions within us, we will be able to combat these health challenges. I believe all of us are passionate in safeguarding the health of our dear state and indeed of our dear country, Nigeria. Most of us are the frontliners in our families and community, and we must strive to help them achieve better health and well-being. Our government needs to support a genuine understanding of the implications of our traditional health beliefs and work with AKISAN on its health mission, and they should also work with other groups that have the same and aligned interest. Our government needs to be more responsive and spend more time to plan and deal constructively with change in collaboration with community groups. Society themselves should view health as an asset, just like monetary entity. Empowering the community to be active participants in maintaining their health is paramount. New and innovative community-based programs or technology are needed and should be welcome. So what is the role of information technology then? Information technology and social media should be used to our advantage in promoting health and clarifying the misinformation or misconceptions arising from the public. Most of us on Facebook have seen a few pictures that have made the rounds. A woman sitting on the roof. I bet you that woman is living in her teenage age based on her brain capacity. And when she went up that roof, to God who made me, she only saw herself as a teenager because that's her brain capacity. But you've heard the wailing, people screaming, "Come down, witch, fly," and so on. We really need to rethink some of our traditional beliefs. Information technology should help our healthcare providers to provide true and scientific-based information, fighting back the myths and never giving up in educating our society, providing information that is just, easy to digest, interesting and attractive. Let's be technology savvy and social media friendly in promoting health and well-being. ICT can continue to help our health and social care, and there are different things that it can help us do, like disseminating the right information, enabling remote consultation, supporting more effective health research, strengthening our human resource. One of the things that I'm planning as part of my dementia campaign is to set up satellite centers in Akwa Ibom State where I can beam lectures from my colleagues who are highly reputable on dementia care. Information technology will help us to deliver public health campaigns across the globe, from the UK, through satellite systems, through webinars, to health professionals and the public. So information technology is fantastic, and we do need to use it positively. There are some conclusions that I need to draw about using information technology in our health sector. These conclusions might seem simple, but we do need to look at it properly. They include things like keeping technology simple, relevant, and local, building on what we have, involving users in the design by demonstrating benefit, strengthening capacity to use, work with, and develop effective ICTs, introducing greater monitoring and evaluation, including communication strategies in the design of IT projects, continuing to research and sharing learning. This is our time to develop local content that is relevant, appropriate, and practical. We need to strengthen organizational and national human resources, awareness, skills, and leadership. In summary, our traditional beliefs and cultural practices affect our health, either negatively or positively. Our health considerably affects our scientific, economic, and technological development, and vice versa. It is a combination of these factors that determine our life expectancy, growth, and development at any one point. Ladies and gentlemen, I want to end this address by reminding us that the bigger the challenges, the bigger the opportunity. Today's challenges called for very bold approaches. Let's change our challenges into opportunities so that the health and well-being of every niche and corners of our dear state is well taken care of. I applaud AKISAN for providing us this opportunity and the platform for all of us to play our part. I wish you all an enjoyable evening. Thank you, thank you, thank you.
Thank you very much, Professor Uduak Archibong. Akwa Ibom, is that the only way you know how to clap? And give her a hand, please. This is Akwa Ibom man making things happening around the world, around the globe, London, England. She did it, and she's going to do more for us. For those of you that know her, she never missed a convention, I think, for the last 10 years. Professor, muchas gracias. Thank you very much.